So a lot of patients are very concerned about whether or not it's safe for them to receive the COVID-19 vaccine. We do know that the COVID vaccine is not a live virus, and because of that, it has not shown to increase the risk of miscarriage in the second or third trimester, and also has not been shown to increase risk of infertility in patients.
According to the data gathered by the CDC on side effects for the Pfizer and the Moderna vaccines, that there are no significant negative side effects to pregnant women. And obviously the studies are ongoing and this is preliminary data, but it's really encouraging and gives us much more guidance going forward with how to get this out more and this news out more to the pregnant population. While I work here at Rush, I worked with patients on the COVID floor and saw daily what COVID does to people and just how severe this disease is. My husband and I did a lot of research on this and were convinced very easily, and also talked to our doctors, that this was a positive choice, that getting the vaccine was something that was going to positively impact us and allow us going forward the protection that we needed against severe symptoms.
It's very important for pregnant women to consider the vaccine because it all takes place in the setting of a global pandemic. Pregnant women who get COVID don't do as well as their non-pregnant colleagues. So those are the patients we really don't want to leave out in the opportunity to become vaccinated.
What we do know is that pregnant women who do get infected with COVID-19 tend to have poorer outcomes. So they tend to have more exacerbated symptoms. They tend to have possibly more ICU admissions or just hospital admissions in general. So I think if you are pregnant or considering pregnancy, it would be a good idea for you to receive the vaccine to help prevent a more severe illness from COVID-19.
It was a quick shot. I had very minimal side effects with the first one, and everybody kind of guaranteed that the second one would be the harder one to get through, and that has been the case. And I was really tired and kind of felt a little icky for a day or so. But other than that, it was a very positive experience. It was pretty normal, like getting a flu vaccine.
Our best guidelines at this point with regard to the vaccine is that pregnant and lactating women should be given the opportunity to obtain the vaccine, but should be obtained in a discussion with their healthcare providers.
Do you live in a household where you're taking care of elderly mom or grandmother that have asthma or diabetes? Do you live in a community where the rates are disproportionately affecting, like African Americans and Latinos? Is that a concern for you? Do you travel to work, or are you still having to present to in-person work, or do you work from home? So all of these things are considerations that may help you decide and kind of weigh out those risks and benefits. And regardless of your decision, as your providers, we're here to support you.
It was the right decision for me because not only does it prevent severe infection in pregnant women, where again we know that it's worse, the disease is worse, and again the death rate is higher, but now also we know that the research is telling us that it will confer antibodies to the fetus, to the baby. So it protects these babies as well, which is really wonderful news and also very encouraging.
COVID is very real. We have an opportunity to have a vaccine and get in front of it. The side effects of the vaccine, the long-term impact of the vaccine, while not 100% established, has not been shown to have any long-term side effects. While we do know for a fact that COVID has been established to have long-term side effects.
If you have any questions regarding the vaccine, it's always best to seek the advice of your OBGYN provider.
My husband and I are just overjoyed. We originally saw a fertility specialist for this little one, so it was, to me personally, an even more important pregnancy, a more high-risk pregnancy, and also one that I needed to protect more. That was my motivation for doing this. I had no negative side effects aside from what was normal and what was promised when the research came out, and everything's great. Yeah, I feel really wonderful.